Hello everyone, welcome to another video. In today's video we'll be looking at chronic obstructive pulmonary disease. So this chronic obstructive pulmonary disease, also known as COPD, is a long-term lung condition that makes it hard for a person to breathe. So it mainly includes two diseases. It includes chronic bronchitis, which is a long-term inflammation of the airways with mucus production, and it also includes emphysema. Emphysema is the damage to the air sacs, that is the alveoli in the lungs, causing air trapping. So COPD develops gradually over time, usually due to long-term exposure to harmful substances like cigarettes, smoke, or environmental pollutants. So it is a progressive disease, meaning it worsens with time, especially if it is left untreated. So looking at the background of this condition, COPD is one of the leading causes of death worldwide, and it typically affects middle-aged or older adults, and it is more common in smokers, but non-smokers can also develop it, especially with long-term exposure to dust, fumes, or like indoor smoke from cooking fuels, or maybe if they are working in a factory that they inhale these smokes, maybe from the generators or something. So early stages of this COPD, they may go unnoticed because symptoms like cough and breathlessness develop slowly. So over time, however, breathing becomes more difficult and can severely affect the quality of life of the person. So for the causes of COPD, the primary cause of COPD is long-term exposure to lung irritants, particularly cigarette smoking, which is the most significant risk factor. Then we have air pollution, including indoor smoke from burning wood, charcoal, or kerosene. Then we have workplace exposures to chemicals, smokes, fumes, dust, and then in rare cases, it could be genetic. So people with a particular gene known as the alpha-1 antitrypsin, so if they have a deficiency of this, alpha-1 antitrypsin 1, so if they have a deficiency of this, they are more susceptible to this COPD. So that is how it is related to genetics. Then we have the causes that could be due to respiratory infections. So repeated infections in children can damage the lung development. So for the anatomy and the physiology, which we have to look into to understand COPD, so we have to understand how exactly normal breathing works. So the airways, that is the bronchi and the bronchioles, they carry air in and out of the lungs. So the alveoli, they are like tiny sacs at the end of the airways where gas exchange happens, like oxygen in, carbon dioxide out. So elasticity of the lung tissue allows it to expand and contract easily with each breath. So when a person has chronic obstructive pulmonary disease, the airways become narrowed and inflamed. There's excess mucus clogs like in their airways. Then the alveolar walls break down, reducing the surface area for gas exchange. Then lungs lose their elasticity, making it harder to push air out. So basically, here's what happens inside the lungs. So an irritant triggers chronic inflammation in the bronchi and the alveoli. So in chronic bronchitis, the lining of the airways thickens and mucus producing cells, they multiply. Then in emphysema, the enzymes released during inflammation damage the alveoli walls. So the alveoli merge into larger air spaces, trapping air and reducing oxygen exchange. So over time, the gas exchange is impaired, leading to low oxygen and high carbon dioxide in the blood. So respiratory muscles have to work harder to move air in and out, and the heart, especially the right side of the heart, may also become strained, leading to complications like heart failure. So for the diagnosis is based on a combination of clinical evaluation, history, and tests. So patient history is taking like symptoms like chronic cough, sputum, breathlessness, and if the patient has like a smoking history or like a history of exposure to all these smokes or irritants, then physical examination is done to check for signs of wheezing, prolonged expiration, or barrel-shaped chest. Then spirometry is done, which is the main test to confirm chronic obstructive pulmonary disease. So it measures how much air the patient can forcefully exhale and how quickly. So we also have chest x-ray or CT scan, which may show lung changes like hyperinflation or flattened diaphragm. Then also arterial blood gas test, which checks oxygen and carbon dioxide levels in the blood in advanced cases, like people that have very serious forms of this condition. Then there's also we can also check for the alpha-1 antitrypsin level, which is which, like I said, if this person is deficient of this gene, it puts them at a higher risk of having COPD. So we can check for this level, especially in younger or non-smoking patients with early signs of COPD. So for the treatment, there is no cure for COPD, but symptoms can be managed and progress, and the progression of the condition can be slowed down. So number one, the best way to manage it is, if you are somebody that smokes a lot, just try to stop smoking. So smoking cessation is the first one and is the most important step, which helps to slow the progression of COPD. Then medications like bronchodilators like salbutamol, tiotropium, and these bronchodilators, they can help to relax the airway muscles. Then we also have inhaled corticosteroids, which can reduce the inflammation. Then combination inhalers too can be used, but they are often used in moderate to severe cases. Then oral steroids can be useful during flare-ups. Then also antibiotics if bacterial infection is suspected, and phosphodiesterase 4 inhibitors like roflumilast. So we can use this in certain cases. Also vaccinations, like getting the vaccines for all this COVID-19, flu, pneumonia, they can be useful to reduce the risk of infections. And also oxygen therapy is given for patients with low blood oxygen levels. And then there's also something known as pulmonary rehabilitation, which is the supervised exercise and education programs that are given for patients that have COPD. Then surgery is done rarely, and procedures like lung volume reduction or transplantation are considered during the end stage disease. So that's when they are considered. So is in rare cases. So for the management, basically long-term management focuses on preventing exacerbations and maintaining the lung function. So the best way to manage this condition is to avoid triggers like smoke, dust, cold air. Just try to avoid all these triggers. Then maintain adherence to inhalers and ensure that you are using the correct technique, and ensure that you are using this inhaler regularly. Then try to maintain a healthy weight, because malnutrition is very common in people that have COPD. So try to maintain a healthy weight and exercise regularly, because this will improve the endurance, and it will improve your endurance and your breathing capacity. Then it's good to also monitor for like complications. So try to go for regular hospital visits to monitor for certain complications, like for example heart failure, and just try to do regular follow-ups. If you are on medication, do regular follow-ups with your pharmacist or your doctor to know that you are using this medication the right way and the medication is actually helping your condition, like slowing the progression. So in summary, chronic obstructive pulmonary disease is a progressive lung disease caused mostly by long-term exposure to irritants like cigarette smoke, dust, and it includes chronic bronchitis. So it includes two diseases, chronic bronchitis and emphysema, which lead to airflow limitation, breathlessness, and frequent coughing. Though it's incurable, we have management techniques, we have medications that can help to slow down the disease progression, and also certain lifestyle changes like smoking cessation and trying to adhere to medications or inhalers that are given can significantly help the patients in living with this condition. So that is all for this topic. I'll see you in the next video. Thank you for watching. Bye.